Hey guys, morning. I've just woken up and as you can see, somebody's sleeping there. So, what I want to talk about today is colic, hiccup, engorged breast, and false teeth. Yeah, those are what I want to talk about in this video, and specifically in newborn. Hiccup in newborn, false teeth in newborn, engorged breast in newborn, and colic in newborn. So guys, okay, most of the time you usually get that newborn usually have hiccup. Let's start with hiccup. So when you are infant hiccups, it can sound cute and sweet, but it might be okay. You might be also wondering if it is normal. The answer is yes, it is normal. Baby and newborn hiccups are completely harmless and just one sign of baby's growth and development. Still, they can be little disturbing to you and your partner. So, because some of the time, or most of the time, when the baby get hiccups, they won't be sleeping, and even if they are sleeping, they will get up, they will start crying. Some newborns usually cry when they get hiccups. So it can be disturbing to the mother and also to the father of the baby. So what I want to insist on is that hiccups in newborn is normal, and so it should not disturb you even as much as they can say. And also, let's talk about the cause. What are the causes of hiccup in newborn? So why do baby get hiccups? Why do baby get hiccups? Hiccups are most likely caused by irritation to the diaphragm, the muscle at the base of the lungs. Sometimes that muscle starts to spasm or cramp, and that causes the vocal cord to clamp shut, creating the destructive hicks, or the sound you usually hear. So developing baby can get hiccups even before they are born. Yeah. And many pregnant people can feel that telltale flutters in their bellies, and that usually, if you know how to feel them, then your baby usually get hiccups, and you can know when you are pregnant. So hiccups are especially common in newborn and infant. We don't know exactly why, but hiccups may be caused by increased gas in the stomach. So that is how research says. If babies overfeed or gulp air during eating, that could cause the stomach to expand and rub against the diaphragm, generating the hiccups. Okay, hiccups and gastroesophageal reflux. Let's talk about it. Usually hiccups don't bother babies, but sometimes hiccups are sign of gastroesophageal reflux. So the reflux causes stomach acid to back up into the baby's esophagus. If your baby has a gastroesophageal reflux, hiccups won't be the only symptoms. So infants with reflux also have the signs such as coughing, spitting out, irritability and crying, arching the back, especially during and after feeding. If you notice these signs, talk to your doctor about whether your baby might have a reflux and how to manage it. Let's talk about how to stop baby hiccups. If your baby doesn't have a reflux symptoms, don't stress over a hiccup because it is normal. But if those little hiccups are bothering you, there are some things you can try. Change feeding position. Don't feed the baby, don't feed the baby when the baby is flat, yes, or when the baby is sleeping. If even some women like breastfeeding the baby when the baby is lying, so don't do that. Or change the position of feeding. Also, bump more frequently. Bumping usually help with hiccups. So bump your baby during feeding to prevent hiccups from striking. Try taking a bump break after 2 to 3 feeds. Reach for the binky. Pacifier can sometimes stop hiccups in their track. That is why you get that the whites like putting pacifiers or they like giving pacifier for the babies. Let me tell you, my baby doesn't like pacifier, and even I bought it, and he has never used it. So the sucking motion can help relax the diaphragm. Yeah, give a grip of water. Grip of water is over the counter in most of the chemistry. So go and give your baby a grip of water so that it can help your baby. That is only if those hiccups are bothering you. Those are the things that you can do to stop what? To stop hiccups on your newborn. Most of the time, hiccups are normal in newborn, so don't disturb your baby with a lot of things that you are trying to do so that they can stop. They will just stop after 1 or 2 minutes. They will stop unless the baby is having maybe gastroesophageal reflux as a condition. So if they are bothering you, I can also advise you go and see your pediatrician. Yeah, apart from that, let's stop from there. Let's meet in the next video. I'll be talking about these things. I've already talked about hiccups, so I'll talk about colic, engorged breast, and false teeth, which is also common. And most women in African countries, they usually get bothered by these things. So another thing that I want to say, most African women usually put a paper. They take maybe a paper like this. They put saliva on it and they put it on forehead of the baby. It does not have any effect on the baby. Tell me the connection with the saliva and this maybe a paper on a forehead of the baby. There is no connection. So it is just a belief that that doesn't help. After all, after 1 minute or 2, the hiccups will stop. So there is no any connection. There is no scientifically proven. It is not scientifically proven. So stop disturbing your baby with these things that look like look like uchawi. Yeah, they look like witchcraft. That is what I mean. So stop disturbing your baby with all those. Otherwise, bye till next time. Let's meet in the next video.